Next, we would like to invite Dr. Parthasarathi Roy, and he will be speaking on a novel study on Timolol Maleate 0.5% eye drops as a potential agent for presbyopia correction. Dr. Parthasarathi, sir.
Good morning, everybody. I will be presenting my innovation in novel study on Timolol Maleate 0.5% eye drop as a potential agent for presbyopia correction. I am Dr. Parthasarathi Roy. I have no financial interest to disclose. In recent times, there has been interest among researchers to develop pharmacological agents to treat presbyopia. However, only pilocarpine 1.25% eye drop has been approved by US FDA till date, but there is some inherent problem with pilocarpine eye drop, like compromised distant vision and narrowing of visual fields. We hypothesize Timolol Maleate 0.5% eye drop to have such properties as would be able to treat presbyopia, at the same time overcome the side effects of pilocarpine. Intrinsic tone of ciliary muscle is maintained by mutually opposite interaction between parasympathetic and sympathetic. The parasympathetic tends to contract and sympathetic tends to relax the ciliary muscle, therefore blocking the sympathetic innervation. By instilling beta blocker drug like Timolol Maleate 0.5% eye drop will increase the tonic accommodation and therefore may be helpful in treatment of presbyopia. This mechanism spares pupillary muscles, thus do not have any effect on pupillary diameter and also avoid side effects of multi-drug combination which are currently under investigation. Moreover, by use of Timolol Maleate, distant vision is not affected. So our aim is to determine and compare the near point of accommodation and amplitude of accommodation of the subjects before and after installation of Timolol Maleate 0.5% eye drop. 40 metropic subjects of ages between 35 and 45 were randomly assigned them to binocular once only, installation of 1 drop of Timolol Maleate 0.5% eye drop, intervention group 20 subjects and control group 20 subjects with normal saline eye drop. For every subject, BCBA, IOP, near point of accommodation measured by Royal Air Force rule and amplitude of accommodation calculated from NPA were noted prior to giving eye drop and then at half an hour interval up to 10 hours. This is the result. In this graph, the graph of 20 subjects has been depicted, and immediately after giving the eye drop, there is the near point of accommodation coming progressively nearer to eye until 4 hours after installation, when it is stabilized and maintained for 8 hours. Here, the single graph of the mean of 20 subjects compared with the control. This is the result of the amplitude of accommodation. Here, immediately after giving the drop, there is increase in the amplitude of accommodation, and that is stabilized at 4 hours, and up to 8 hours this remains. Here the mean value compared with the control. So, near point of accommodation maintained a steady state between 4 to 8 hours of installation at point closer to eye by an average of 5.79 centimeter. This tantamounts to presbyopia correction of plus 1.21 diopter sustained for 4 hours between 4 and 8 hours after installation of drop. There was no blurring of distant vision and no statistically significant lowering of IOP. So our conclusion was 1 drop of Timolol Maleate 0.5% drop instilled binocularly can achieve correction of presbyopia to the extent of plus 1.21 diopter sustained for 4 hours between 4 and 8 hours after installation of drop. Thank you.
Thank you, Dr. Parthasarathi. Judges, please.
Very nice study, Few things are I want to check. Once you talk about increasing the amplitude of accommodation in these patients of range of 1.21 diopters,
Yes, sir.
will there be a change in the absolute refractive error in these cases also? You said distance and vision was not changed at all.
No, sir. We have checked the distant visuality. It is remaining the same. We took the emmetropic subjects, first of all.
Because
So
these-
it remains emmetropic even after giving the drops.
Because these are young.
There was no change. That is-
your group of patients are very young, 35 to 45.
Yes, sir.
And emmetrophs, up to age of 40, they can manage, And their as such amplitude accommodation is so high. I don't know how much effect beta blocker will do in those cases. And these young patients, did they have some systemic change also? Did you look into other aspects also of side effects of beta blockers in these cases?
No, sir. First of all, we have given 1 drop of Timolol Maleate and taken the result. 1 drop of Timolol Maleate once binocularly. This is a pioneer study. This study has been taken in the world for the first time with the Timolol Maleate. No study has been taken as yet. So we
apart from-
wanted to make
no,
it sure that there is no safety issue.
Good, good. Apart from the the measurement you have done, nowadays all those studies which people are doing with the pilocarpine, they do a dynamic anti-segment OCT pixelization of change in the lens and
Yes, sir, those are there. But we have employed the simplest thing. And you will find that there is 20 graphs. All the graphs I have shown the equal, the similar pattern. So this is a very unique thing about my study.
Okay.
The result.
Any more questions from any judges? Thank you, Dr. Parthasarathi.